Good afternoon. Thank you for attending the Monitoring Health Events in Dairy Herds webinar presented by Dr. Gustavo Schuenemann, Associate Professor, Extension Veterinarian with The Ohio State University. My name is Eric Pulaski. I'm the Sustainable Agriculture Educator with the Ohio Ecological Food and Farm Association, and I will monitor this afternoon's presentation. This event is part of a series of educational programs offered by OFA and the OSU Veterinary Extension to practicing veterinarians, farmers, and animal health professionals who work with certified organic livestock. OFA was founded in 1979 and is a grassroots coalition of farmers, backyard gardeners, consumers, retailers, educators, researchers, and others. For more than 35 years, OFA has used education, advocacy, and grassroots organizing to promote local and organic food systems. We are also one of the country's largest and oldest accredited organic certification agencies, certifying a diversity of operations throughout the Midwest. More information on OFA is available on the web, www.oeffa.org. With an office in every county and celebrating its 101st year, OSU Extension is the official outreach program of The Ohio State University's College of Food, Agriculture, and Environmental Sciences, with additional faculty and staff in the College of Education and Human Ecology and the College of Veterinary Medicine. The core of OSU's extension focuses on 4 areas: enhancing agriculture and the environment, strengthening families and communities, advancing employment and income opportunities, and preparing for youth for success. Partial funding for this webinar is provided through a grant from the North Central Region Sustainable Agriculture Research and Education Program. ncr-sare has awarded more than $40 million worth of competitive grants to farmers, ranchers, researchers, educators, public and private institutions, nonprofit groups, and others exploring sustainable agriculture in 12 states. We thank SARE for this support. The questions this afternoon will be moderated. If you have a question, please type it into the question box on your screen. We will have time for questions at the end of the presentation. Please feel free to submit questions or points of clarification as they come to mind. Questions will be monitored and held until the designated question period at the end. OFA is pleased and fortunate to introduce Dr. Schuenemann as our presenter. Dr. Schuenemann has direct experience in clinical, production, and research aspects of the dairy industry, and we hope that this presentation can enhance the triple bottom line of your organic dairy operation. Without further ado, Dr. Schuenemann.
Well, thanks, Eric. And anyway, so we are going to go through this monitoring health event in dairy farms, and I will go through just for this presentation. We are going to focus on how to screen for specific conditions of diseases. And I will focus on 2 aspects. I will focus on cows, just for a selected group of diseases because of the time limitation for this webinar. And I will focus on 3 of the most important for calves that I think are key for performance, especially for female calves that will be the future replacement of the farm. And then some of these will do apply, you know, either organic or conventional farming. So health, we know that health is key for performance, and what I mean by performance is I just either milk production or reproductive performance. About 30 to 50% of cows are going to develop some sort of hypocalcemia, some of the metabolic problem, either hypocalcemia or ketosis, early lactation, and that has a direct implication in the immune system, and therefore metritis and mastitis might be also a challenge. And I'll talk a little bit about this condition and how we do identify cows under field conditions. And I will do a little bit of focus on calf diarrhea and pneumonia, and because those are responsible for a pre-wean mortality. So either 20 to 43% of the calf mortality are associated with this condition. And early identification of these sick animals is key. So you just need to know what to look for and why is that important. because that increases significantly the chances of recovery. It does reduce the risk for mortality and culling, and therefore has an animal welfare implication on this. The reason why I'm going to focus on heifers, especially pre-wean calf, is because this is a very nice study looking at risk factor for lifetime performance of replacement. And when you look at the calf, especially what happened in those first 60 days of life from birth to weaning, right? Each unit of calving difficulty, so when cow experience difficulty or dystocia at calving, right? Each unit of increment, as it is more difficult, milk production is going to be reduced almost 200 kilos, or what it would be about 400 pounds every year. It does affect the lifetime performance. It's a direct implication in the lifetime performance of these future replacements. Weaning age, when you look at how old they are in days at weaning, that has a huge implication as well. And we do know that one of the factors for growth and performance and weaning age is whether or not they get sick prior to weaning. But weaning age, meaning they are at 60 days or older, especially they are more than 90 days, they will have 463 kilos of what it was almost 1,000 pounds per lactation reduction. Days ill, so how many days the calf is sick, also has the more days they have, it has a negative implication. And the next one is dry matter intake. So how much these baby calves are eating at the end of the first phase, prior to weaning. For every kilo of dry matter that they eat, more they will produce, 286 kilos, or is almost 300, almost 500, 600 pounds of milk. So those are directly implications in the lifetime performance. So that's what I really want to focus on, pneumonia and diarrhea, because they will have long-term implications for future replacement. I think the first most important aspect is that you have to have some sort of guidance, what we know as protocol. You need to have some sort of guidance and for health management. And you have to work, together with your veterinarians, put together these, bullet points and how you are going to go through those steps that I'm going to just very brief. I'm going to cover a few of them. And once you establish those, protocol or SOPs, standard operating procedures, individuals doing these screening process or steps, they have to have some sort of knowledge and obviously skills, and it has to go through a cycle of training and what you are looking for, what to look for, and who is going to be responsible to do this. And so you are on a time basis, you are looking at the disease, the same disease for the same cows, every month. So I give you now a few examples once you have established a particular protocol, and we're going to go through a few of them. So when you look at health, I'm going to cover both a few diseases for cows, and here is just, as cow approach parturition, some of those, risk factors. Many of our diseases, especially what I'm going to discuss for these presentations, are early on in lactation, right? And I'm going to start right off at calving, especially I'm going to look and try to define dystocia, because I think this is the most important. And once the cow goes through a calving, right, a number of challenges are going to, a number of things challenge the cow, especially when the cow initiates lactation, and she got early on, compromised dry matter intake. So what you see on those conditions, especially if pertain fetal membranes or metritis, then you have to put all these together to see what is causing all these conditions. So now I'm going to focus on these cows, and at the very end, I'm going to finish my presentation talking about water quality, right? Because at the end, water quality, that has a negative implication on the cow, especially it's going to affect, pretty fresh cows. And the cow, depending on your water quality, may or may not be able to control hypocalcemia. So usually we do make an effort in prevention of hypocalcemia because we know that early on in lactation, hypocalcemia is associated with the immune system, and if we have a weak immune system, we are going to have more infectious diseases on cows. So for pre-fresh cows, and I'm going to just try to define these two conditions, and I'm going to focus at calving. I think it is important that that we look for these cows that may or may not have compromised define stillbirth, and also I'm going to define retained placenta or retained fetal membranes. The first one is the dystocia, and I started with this very simple question: is this the front of the rear leg of the calf, right? The most important there is, how do we recognize that the cow goes through normal delivery, right? What is normal delivery for a cow? And here there are differences between a heifer that will become per lactation versus a multipair of cows, right? So this is the picture that shows there, these are the front legs of a calf. But this is just showing you a severe dystocia. And the way that I know that has, for this particular picture, the position of the legs, the front leg of the calf, and they barely fit in the birth canal. So that, parturition itself is a process, and the pain, it's a painful process, and for the animal. Usually they do recover without much issues, and but they do experience severe dystocias, and that would definitely may compromise dry matter intake, and then this is why the cow that has it's in pain, usually she's not want to walk or eat as much, and then they were more likely to develop metritis. So when keeping records at calving, so the degree of assistance, there are different scales, and you can choose any one of them, or a combination of them, from 1 to 5, from 1 to 3. I like to use personally from 1 to 4, and usually they scale all these scales. Just is the degree of assistance that has to be provided during parturition. 1 is normal, and either 3 or 5 in these two particular cases. Those are either surgical procedures and or assistance was provided. So they, in this particular 1 to 3, they have just to provide, pull the calf out, and so this is very important, because that when you process information at the end of the year or every other year, that tells you where the problem might be, and for a calving program, a calving program and controlling dystocia, it really starts at birth. So that female that is just born, how that female reach, in 2 years later, she's going to be pregnant, she's going to go through parturition. How we manage from birth to calving those future replacement, it really does important, because there is a inclusion component to this problem of dystocia. There is breeding components, and within breeding, reproduction, where we are using bulls or we are using AI, and within the AI, how we use, whether or not we are using easy calving sires. So just to put this together on record keeping aspect, this is just a very simple spreadsheet that and then these are important information from the cow ID, whether you may have one group of cows, or it might be a larger farm that has different groups. The date, the body condition at calving. The body condition at calving I won't cover in this particular seminar. We will likely cover in another one. but that is an important component, and we use the scale from 1 to 5. And when the cow starts parturition and when actually the calf is on the ground. So there is a time lag between the process of parturition, and this is what we define when the cow is, showing the amniotic sac or the water bag. The cow is either showing feet or the amniotic sac. So that would be time 0. And then when, actually the calf is on the ground. So parturition has completed. So that it's about, it may take about an hour and a half, just the process. Whether the calf was alive or dead, sex of the calf. Here is the scale, and this is just printed on a paper, and they just make circles to this, like I just give you an example here. And PHS, this is just, understanding what PHS stands for, is the perineum hygiene score. This is how much manure we do have in the perineum when we are dealing with parturition. The higher the hygiene problem, so score 3 will be a high score, and so the more likely the cow will develop some sort of uterine problem, specific metritis. Stillbirth, the calf ID, any comment whether this is a twin or just a single or a premature calf, and who was responsible for, attending or just taking care of those cows at parturition. I did mention about stillbirth. I think this is important because it's directly associated. This is an animal welfare component, and stillbirth is defined as the calf born dead or die within 24 hours after birth. And these are for cows that have normal gestation length. So this is not a premature calf, and this is a calf that is being born either alive and died within the first 24 hours, or it was dead, so at the time of parturition. So, and here there is a lot of variation. So we have, according to the USDA, there is a lot of variation in how many losses we have. There are farms with about 2-3% calf losses around parturition, and there are some others with about 8, or even in heifer up to 20%. So how we control this is very an important component, because it has a direct implication in your replacement. So this will do affect the number of replacement heifers that you're going to have available. So for resources on calving management, I'm just providing this website for you. If you want to get more information about calving, definition of condition, definition of perineum hygiene score, what I did mention in the previous slide, and definition of a stillbirth, and protocol for calving management and what to look for and why is that important, including disinfectant, what to use. Just visit this website, and there is a number of PowerPoint presentation and material there. Another important aspect is, you can do this depending on the farm size. This is a 50 cow operation, or this is a 2,000 cow operation. Here an idea, this is the information on calcium. So once the cow goes through parturition, she's going to initiate lactation, right? And there is a specific amount of calcium that goes to milk. So milk has, calcium there. So the cow, to avoid, calcium is very important for cows. So it's involved in many processes. But the most important is for the immune system, right? So we always monitor calcium level in cows, especially early on in lactation. The first, after 24 hours after calving, and see whether or not cow has low calcium level in blood or not. So basically, what you want to look, what this information is showing you, this is the calcium concentration, total calcium in blood, and here is lactation numbers. So these are my first, they were heifer. After parturition became first lactation, second, third, fourth, 5, and 6 and 7 lactation. So The gray square is, this is normal concentration. You would expect, and there are different units. So you would be, this is in millimoles. And some other ways that you can see calcium concentration in serum is in milligram per deciliter. So it's same, different unit, same conversions, same values. And so you want to have, each one of these dots represent a cow. So you want to have your cows within this gray square. So they are either more than 2 millimolars or 8.0 milligrams by deciliter. So if you are below that, that might be an indication that the cow is at higher risk of developing some of the conditions that I'm going to talk now in the next few minutes, especially retained placenta and metritis. Right? And this is obviously, you can see this one. This is when the cow has milk fever. So this is just basically a downer cow. This is when you go to the field or go to the farm and you see the cow can't get up, right? And but in general, every time that you see one of these cows that has developed the clinical signs of very low calcium and she cannot get up, you're going to have about 20 subclinical. These two groups of cows have higher risk of developing uterine infections, and because the immune system is compromised. So, and here are some parameters and reference values for looking at a specific in blood calcium. Right? And as I mentioned before, I have expressed now in milligrams by deciliter, but it's the same as millimolars, the unit change and the number, and as well as looking at these two parameters, right? BHBAs and heifers, right? And these are two markers that you can easily do it, and the veterinarian will be very glad to help you on set up how to measure these two. That will be an indication of the negative energy balance of the cow. So that is important. I know if my cows are in negative energy balance, I know my calcium status, then I'm going to start putting together my my diseases, right? I have urine pH here. Urine pH is usually, you're going to measure urine pH if you are feeding, in organic farms probably you don't feed anionic salts to pre-fresh cows, so you probably don't have a need to measure urine pH. But for those farms that are feeding anionic salt is, I'm going to explain at the end of the presentation what it is. And it reduces the urine pH because this is one of the ways that we have to control hypocalcemia. So induce a metabolic acidosis to be able to control early on in lactation hypocalcemia. So here are some parameters where the cows on average and some of the range values. And here is the alarm system or the alarm level. So if I measure some of these units, some of these markers, either BHBAs, heifers, or calcium, right? The way that you interpret this is if I measure in 25 animals, right? I sampled 25 animals and I found 3 or 4 animals. So this is more than 15%. So anytime that I have more than 15% or more than 10%, or in a specific in heifers, nipple heifers, more than 1% in calcium, that would be an indication that I may have some issues. And then that issue might be associated with the management of what I'm feeding the cows, because that is always directly associated with the cow developing the disease. And also have the group of cows at risk and associated diseases that are associated with some of these parameters. Retained fetal membranes, and here it's important because the way that we define either RPs, retained placentas, or retained fetal membrane, they are the same thing. Is defined as a failure to expel membranes 24 hours after birth, right? And normally for cows, the placenta will be expelled within 12 hours after delivery. So you're going to see something. This is the very obvious one. So usually we wait 24 hours. If the cow has retained placenta, we just make a note and keep a record of these cows. So the placenta is still attached inside the uterus, and that might be another risk factor for developing uterine problems such as metritis. Another important aspect is looking at metritis in cows. And here is the way that this is just a very simple overview of the cow, how she's, progressing once she goes through parturition. We already saw how to go through and recognize dystocia and keep record of dystocia. What is an stillbirth? What is retained placenta? I have the time component in each one of these, and then metritis. Usually, I just place metritis 10 days plus minus 3 days in milk. And usually metritis, the peak of cow with metritis is going to be here, right? But the definition of metritis is the first 20 days in milk, the first 20 days in milk. And so here, each one of these conditions has a time component that defines the disease. So for metritis, here is an example of when you want and look for this protocol as a steering condition. This is every cow that goes through parturition will be checked once she is reaching, day 6. It will be mandatory for the cow to have a physical exam on day 6, a physical exam on day 8, and a physical exam on day 10. Right? This is the most likely area as far as time days in milk goes, and to be able, if she develops metritis, we should be able to see it there. So it is mandatory for the cows and for this particular protocol to go, on day 6, 8, and 10, and then we just do observation either at the parlor and milking, and get an idea how the cows is doing. So I'll show you now what the observation is and the physical exam. As far as the definition goes, metritis is an inflammation of all layers of the uterus, and it does have to have systemic signs of illness, so the cow has to be sick, right? And you can have a vaginal discharge, so the cow has this vaginal discharge, but she's not sick, right? Yes, it does have an implication on reproductive performance, but the cow does not show systemic signs of illness, like fever, reduced appetite, and decreased milk production. And the decreased milk production is basically because all these uterine diseases are painful, and if the cow develops fever, she's not going to drink as much water or eat as much feed, and then milk production is the one that is going to be affected. So that is, milk production is an important component when we do the physical exam on cows. And the clinical signs are, that the classic stinky smell, brown, red, watery vaginal discharge within the first 20 days in milk, and fever. So, and I placed the 2 units there, and these should be in Fahrenheit. This one, 103 Fahrenheit or 39.5 Celsius. So the assessment, when you go to these cows and you start looking for metritis, usually you just do a quick look and an assessment of the cow. You look at the front of the cow, you look the side of the cows, and then you look the back of the cow. So in each one of these points, you are going to be looking for specific things. Remember those day 6, day 8, and day 10 in milk. So each of these cows, as they go through parturition, they will have to go through some sort of standardized assessment that we look for all these same parameters and in all my cows on the farm. So what I look on the front. So when I look at the front of the cow, I look the ears, I look the eye of the cow. Usually cows are going to have shiny eye, rounded, shiny eye. The ear has to be, when the cow is alert and she's eating and acting normally, the ear is a clear indication whether or not the cow is sick. And attitude, right? How is the cow alert or not? The nose, and whether or not she might or may not have some respiratory issues, and feed intakes. So all these things I'm going to be looking at, when I have my cows on the farm. And here is just a farm with a headlock for fresh cows. So what I do look very quick, one individual might be looking whether or not the cow is eating, and their ears and their eye, so I get an impression, and because that tells me that the attitude of the cow and the appetite, and she's alert, and she doesn't have anything, any respiratory associated problem if I look at the nose of the cow. So when what to look from the back of the cow. Right, body condition score, like I mentioned before, we are not going to do it, but usually this is a good way of doing it, and especially if you see that the cow are losing too much weight, right, very fast early on in lactation, because that might be associated with some of how you manage your diet, how you formulate your diet. So the cow are producing milk, but what we provide in the diet is not enough to meet the mammary demand. So the cow is losing weight to compensate energy demand. Vaginal discharge, whether or not cow has lameness or hot lesion, retained fetal membranes. The other field, this is important, and sometimes you do this assessment after milking, and you have an idea how much these cows will produce, right after milking, or you can do this prior to milk and just get an idea about, the other field. So when the other, like a cow, like is shown in this picture, she got a sperm udder with milk, so that is an indication of, a healthy the cow. She's eating dry matter, she's acting normally. Breathing rate, if you're looking from the side, and posture, and this is just associated with the coat of the cow, just looking at the hair. So when I put all these together, right, this is just, you do this in a very quick screening and looking at the cows, so you get an idea about, the tail of the cow. This is just, especially if you're looking for this area, discharge associated with the vagina or even in the tail, right? You compare the two feelings, how tight the udder is, whether or not, and this is important if you're using, if you're doing this after milking or before milking. But this is important to get an idea how milk production is for this particular cow. Whether or not there is vaginal discharge, and these are the cows that are resting, after milking, she goes, lay down, and this is the classic vaginal discharge. Or here is the cow with retained fetal membrane. Manure is something you score manure in these cows, as you should get an idea how the GI tract is working. And if you are doing an assessment for milking, you can see also get an idea how is the milking routine in this particular cow, and teat dip, right, that is associated, they are coming after the pallor, and they all should have the teat dip to prevent mastitis. So also, and this is, the veterinarian can help you on putting something of this assessment for cows, especially looking for cows that may have what we know as displaced abomasum. And so this is just looking at this dotted line with different colors, and here is each one of these areas, represent a specific area inside a specific anatomy, a specific organ inside the cow. So for instance, you're looking, here is looking at the cow from the right side, and here is looking at the cow from the left side. So this is the right of the cow. I'm just standing behind the cow, and here is my right, and I'm standing behind the cow, here is my left, right? So when I look at cows, and I just, this particular cow, she don't have metritis, she doesn't have pneumonia, and but she's still not eating well, and she seems to be some sort of digestive problems. So then you suspect that the cow may have some what we call left displaced abomasum, right? So here is the area where you will look, and you will look and check the cow for that particular noise, right? The abomasum will full of gas, and it makes a particular noise when you hear, and you check this cow. So again, the veterinarian can help you put all these together, and you can check whether or not this is a cow that may or may not have a display sabomas. Mastitis is another important and perhaps the one that has a lot of variation in how we define a cow with mastitis. And so how do I know that a cow has mastitis? So, and again, this is done, during milking. And here I place a picture of what we've been collecting. When you do the milking routine and you are stripping cows, just to ID cows that have potential problems. So these are some of the milk, if you will, or some of the fluids that come out of lactating cows. This dark color red, that is my indication of blood, presence of blood. This is just an indication that milk is completely abnormal, and this greenish color, and this pinkish, color, and then also presence of blood, and then some of the, just normal milk. So this is look like milk. So how we do with this mastitis? So the steps to identify severe cases of mastitis, and for mastitis, I will look three things. I will look first the milk, and that is during the milking routine procedure, when you are stripping cows, and then you look the milk and how the milk look like, the udder and how the udder look like, and then how the cow. So there are three components: the milk, the udder, and the cow. Right. So grade 1, and with these three components, the milk, the udder, and the cow, you build up 3 levels or 3 components, and each one of the levels, as you go up, level 1 is the least severe, right? Because it's only abnormal milk. So those are the flakes. When you strip, the cow 2 or 3 times, and each time there are just flakes, right? It's just abnormal milk. There is no much the udder or the teeth, that specific part is not inflamed yet. It's just abnormal. It's just grade 1. And usually you recheck cows, and some people discard milk. But they don't do any treatment. They just follow up with these cows. A moderate or grade 2, this is when the cow has both. It has abnormal milk. It got blood, flakes, those flood of milk, and the udder is abnormal. So, and the udder could be red, it could be swollen, and it could be hard to the feeling. So either you can have the 2 options for these cows. So this is definitely a step more of what is the abnormal. So the udder is inflamed or has swollen udder. So either you recheck and discard milk, and also you can do some treatment for this particular cow. Right? And the most severe case is what we call grade 3, is when the 3 components are compromised. This is milk, and the milk, you check the milk is abnormal, check the udder, it is abnormal, so it's red, swollen, hard, and the cow has fever and dehydration, right? And she's sick and usually off feed because of pain and low milk production. So these are candidates for treatment, and you have to discard milk. But anyway, here is an approach on how you determine the severity of your mastitis and how you identify cases and for your particular farm. When you go and look the health status of the calf, so I'm going to talk now about the calf, and I'm going to go through just 2 conditions, diarrhea and pneumonia, that I think are important because this is associated with the first 60 days of life performance of the calf. If that has a direct implication on growth. And I know that how they perform early, the first 60 days of life, will do have, as I mentioned before in my presentation, an impact in the future, performance as a cow. when they became a cow and start lactating. Right? So, and I'm going to go through colostrum management. We already saw stillbirth and failure of passive transfer. So how we, how we monitor colostrum management, how we monitor failure of passive transfer, and how we monitor some of the health events, diarrhea and pneumonia. Because what we want is, this is the most critical period for the calf, and they have direct implication in performance when they became lactating cows early on in lactation. So the top 3 diseases for pre-wean calves, I'm going to discuss the diarrhea and pneumonia. I'm going to just make a few comments regarding septicemia. So septicemia is basically it's an infection that the calf got it early on in life. So that is why it's important. I put within parentheses there colostrum, and the colostrum and bacterial load. So hygiene practices when you are feeding a calf is extremely important. And so usually these are calves that they may die within 3 days, 3 to 5 days of life, right? And then they usually it's a sudden death. You go and just find this calf dead. So that is very likely septicemia. So it's an infection. Remember that the calf, when you feed the colostrum in the first hour or the first 3 hours, so it absorbs the colostrum and it goes right, direct to the bloodstream. So if you have bacterial contamination in your colostrum, that also will get absorbed, and it poses a risk for this calf. So, and then the next 2 that are important also is diarrhea and pneumonia. For colostrum management, I just put together these guidelines for you. There are 3 components that are important, 4 components. Quality, I want to feed my calf with a quality colostrum, and usually you can check this, and I shall tell you in the next few minutes how you can check this on the farm. The quantity is important, at least a gallon, 4 quarts, and usually calf we have to get about 10% of the body weight, and timing, right? You are going to provide this high quality, more than 50 milligrams by meal of IgG, 1 gallon within the first 3 hours. Right? And cleaning and sanitation, this is the most important to prevent septicemia. Right? Those calves that really die, in the first few days, 3 or 4 or 5 days of life. So you reduce the minimal bacterial load. And so how you manage colostrum is very important for the calf survival. So how do you monitor colostrum quality and FPT? FPT stands for failure of passive transfer. So I provide colostrum, and that colostrum has immunoglobulins, IgG, and that is what I measure in my calf, because that determines the failure of passive transfer. So the mom transfers the immunity through colostrum to the calf, right? So you can use some of these digital refractometers, right? What they measure is basically bricks, right? It's the unit. So here is the same digital refractometer. You can measure both. This is serum total protein. It's basically you collect colostrum, you measure, you just put a drops of colostrum inside this container, then you press the go red button there, and it does measure. If it is 22 or more, that it tells you that at least has 50 grams by liter of IgG, right? And serum total protein is, you can go 2 days later after feeding colostrum and get a blood sample from the calf, and then just run, you need to get the serum from the calf, separate the red blood cell from, when you get the serum, then you can place also a drop there, and then you measure with the same device. You measure, if you get a reading of greater than 8.4, that is an indication that the calf got at least 5.5 grams by deciliter of IgG. So those are kind of the cut point to measure my cow has good quality colostrum, and also I'm feeding the colostrum at the right time and the right amount. So my calf are getting the immunity. So, and because that prevents most of the conditions that I'm going to talk now. Calf diarrhea, right? And this is usually fluid feces, presenting fluid feces. It could be with or without blood. And I'm going to show now the score system for this with pictures. So the score is usually, the score goes from 0 to 3. So 0 is normal, 3 is the most affected, right, and scale. And they have either dehydration or fever, so either one of the two. And this is important when you say, okay, I have a calf with diarrhea, not only that it has fluid feces, right, the characteristic diarrhea of the calf, but also has to have a dehydration, so the calf has to be dehydrated or present fever, either one of the two. Then this is a calf that has to have received some sort of treatment. So these are very practical charts that has been developed by the University of Wisconsin. And I placed there the source of the College of Veterinary Medicine, and these are very practical, and how I'm going to go through now how you might be able to use. And you use this one for both. You use this one for pneumonia, and you use this one also as well for diarrhea, right? So basically, you're going to have this calf health scoring criteria that goes and score from 0 to 3, like I mentioned before. So then you're going to have different sections, right, in this one. The rectal temperature, the calf normal is between 100, 101, or 100.9. And then as you increase the score, these are a compromise. So calf has, start having fever. And so whether or not they cough, and interpretation of each one of the scores makes us discharge, so how they go, because it's an indication of upper respiratory problems. And looking at the eyes of the calf, and from a normal shiny round eye to this compromised, that has a lot of secretion in the eyes. And also getting an idea about the ear score, right? And a very alert, calf. To some of these, there might be when the calf has the ear, they drop the ear. That might be an indication of either dehydration or pain, and associated with particular condition. So then you have a fecal score. So this is a little bit dry, what might be a normal fecal score. And as they increase the water content and change the color, you go to more abnormal fecal score. So a scoring chart for diarrhea. So you're going to look for, like I mentioned before, the cat has to have at least a score of 2 or 3, fluid feces, either with or without blood, right? And it has to be dehydrated. I don't have a picture for dehydrations. And but an indication might be dehydrated is when the calf has the ear, they drop the ears, and it has fever, right? So a combination of, having a fever, being dehydrated, and because of the calf is going to dehydrate very quick because of the diarrhea, it's losing a lot of fluid, right? And either a score of 2 or 3, with a combination of these, we will determine, okay, this is a calf with diarrhea, and we have to have a treatment in place for those calves. So the clinical progression of these signs, usually are just very thin and watery feces, and they go and sign of dehydration, especially the sign when you look at the eye, sunken eye, and that is usually a clear sign that they are dehydrated. Dry mucous membrane, especially the mouth of the calf, and rough hair, and they will all go down as the calf starts losing more electrolyte. Right? They became, they go through a metabolic acidosis, and that is when they enter in coma, of what it was here is the loss of conscience. And and it's very difficult as they progress to this later stage and to revert. So just to go back. So the early that you detect this is that increase the likelihood of recovery very quick. For pneumonia, and it's very similar. So it's the same chart, and then you use again rectal temperature, coughing, nasal discharge, and the I score. So a combination of these, and I'm going to give you now an example, because if you go to this website and you're going to find this chart, you can download this chart from the College of Veterinary Medicine at the University of Wisconsin. And they have very nice presentations and interpretation of these scores. And also you look the years and you look the fecal scores of this calf. And here is so I just placed some information for pneumonia and pre-weaning calf. So you're going to have some sort of spreadsheet. You can also download this from the website. And I placed 3 calves here, 3 examples, right? My animal ID, my age of the calf, the nasal discharge, right? My ear, my eye and ear, coughing, and temperature, and the total score. This is the most important, the total score of this one. And here is the interpretation score. So if you got a total score like this one, 0, this is a normal. So less than 4, it will be considered normal. When the calf is 4, this is when you gotta keep an eye on. So you gotta keep watching the calf. And if the calf has more than 5, that is either sick or it needs treatment. And these are the 2 calves that they do have, very likely a pneumonia event. And those are calves that they are sick and they do require a treatment. So a combination of factors, this is a very nice way, standardized way to look at for these conditions as those calves are coming and going through the first 60 days of life. As I mentioned before, I'm going to go very brief through this one. And milk is 80% water, and I think this is an important component. So you're going to look and screen for this condition as I went through very briefly. But you want to know, because the water source usually is the same. This is the water source that you're providing the cows, and this is the water source that you are providing to the calf. Right? It's the same information. Getting an analysis of the water at least every year, it is very important, because you can do 2 things there. First, your quality, and your quality of water make a contribution to the total mineral that the cows are eating. The cow drink water, and also the cow eat dry matter. So the 2 make up the final contribution in water. For those cows, what you're going to look is just those components. When you get the water analysis, you're going to look for potassium and sodium. Those are the positive charges, and also you're going to look for the 2 negative charges, fluoride and sulfate. Sulfur. Right? So these are the charges. And then you place together these 2 charges, this information. So this is the water contribution for my dry cow. Remember, this is the same water for both, either dry and fresh cow. You place the water contribution, milligram by liter is the same as ppm, 5 parts per million. And then you have your diet. You have to know this is percent dry matter. So these 2, for example, I just use the same water analysis that I showed you previously, and I calculate my DCAF, right? So this is a very negative. So it's a very negative because the water has very high sulfur, right? Very high of this. So the cow is a negative, it's a metabolic acidosis. So I want my goal of my pre-fresh cow to be -15, -20. This is -53. And also in fresh cow, I want my cows to be positive, right? But because of this, high concentration of this in the water, the cow still is negative, right? And that has direct implications, because that increases the calcium loss in pre-fresh cows, They drop the dry matter intake because the cow refused to eat. She's in constant metabolic acidosis. And if the cow don't eat, she got into negative energy balance, right? Which increased the ketosis and the risk for disease, metritis, right? And that is where you see, this low performance. My cows are not peaking. The cows don't have a peak of production. Maybe has a direct implication in milk production as well as reproduction. So with that, I just mentioned this animal health regulation and some of the USDA National Organic Program. There's very good information as far as standards and what is approved, what is not approved for specific for organic as far as treatment goes. And with that, I'll thank you, and I'll take any question you may have now.
We are looking for questions. Please type them into your question box on the screen. I'll relay those to Dr. Schuenemann. While we have a minute, I'd like to remind you all that this is a continuing series, that our next webinar will be held on October 8th. That is a review of the Certified Organic Livestock Standards presented by OFA certification specialist Julia Barton. Also looking ahead, Thursday, October 22nd, there is a IOIA, the National Organic Inspectors Association, and the OMRI, Organic Material Review Institute's presentation on organic livestock inputs. That is a certificate webinar. Any practicing veterinarian can receive a scholarship for that, or a professional in the extension service or the USDA programs. Once again, we're looking for questions. Dr. Schuenemann?
I'm here.
Not getting any questions in the box. Is there anything that you'd like to share at the moment?
No, just they can, feel free to email me if they need any more information on specific details.
Good afternoon, OFA. This is Milo.
Okay, I again want to remind you all that the health webinar event on October 22nd is a certificate program, and I want to encourage you all to sign up and take a look at that. Also, we have other resources here, and Dr. Schuenemann will be available if you think of any other questions after this webinar. We can forward them to him by email. Appreciate your time. Thank you for signing on, and look forward to your registrations for the next webinar. Thank you, Dr. Schuenemann.